Hi everyone, I am Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are structured, focused and exam oriented so that you can recall faster and more confidently in your exam. In today's session, we are going to break down the anatomy of uterus into clear, high-yielding, exam-focused concepts. So let's get started. So uterus comes from the Latin word, it's a Latin word uterus, or a Greek word 𝗧𝗘𝗟𝗏, meaning womb. So that is why we use the term hysterectomy in the removal of uterus. So the uterus is a childbearing muscular organ which is present in the females. So this uterus, it provides the ideal site and environment for implantation of the fertilized ovum as well as for the development of the embryo. So if you see the uterus is pear-shaped. It is pear-shaped, and when we see the measurements of it, in length it measures about 7.5 centimeters in length, breadth it will measure about 5 centimeters in breadth, and in thickness it measures about 1 centimeter in thickness, and it weighs about 30 to 40 grams. So this organ, it is situated in the pelvis. So it is situated within the pelvis, that is the lesser pelvis, between the urinary bladder in front and the rectum behind. So superiorly on each side, it will be communicating here with the fallopian tube. This is the uterine tube or fallopian tube. And inferiorly, it will be communicating with the vagina. So this uterus here, when we see, now this is the section, coronal section of the uterus here. So where we can see the fundus, the body of the uterus. So this is the fundus portion. This is the body and the cervix. So these are the three parts of the uterus. So it will have an anterior surface and a posterior surface, anterior surface as well as the posterior surface, and two lateral borders, that is the lateral borders, the right and left. So along the lateral borders, that is at the upper part, the uterine tube will be entering. So this is the, will be attached there. So this is the uterine tube. And anteriorly, so anterior and inferiorly to the tube. So inferiorly here to the tube, anterior-inferiorly to the uterine tube, we will see the round ligament of uterus, and posterior-inferior to the tube, posteriorly and inferior. Posterior-inferior to the tube, we will see the ligament of ovary. So posterior inferior to the uterine tube, we see the ligament of ovary. So this is at the lateral border, at the upper end of the lateral border, we see these structures. So let's look at the position of the uterus. So what is the normal position of the uterus? So uterus, when we say the position of the uterus normally, we say it is in anteflexed and anteverted. So what is this anteversion and anteflexion? So it is anteverted and anteflexed. So when we say anteversion here, the long axis of the cervix, long axis of the cervix is bent forward on the long axis of the vagina. And this angle is about 90 degrees. So this is the angle of anteversion. So the long axis of the cervix will be bent forward on the long axis of the vagina, forming an angle of about 90 degrees, and that we call it as anteversion. And when the uterus is in this position, we call it as anteverted. And what is anteflexion? Here, the long axis of the body of the uterus. Now, this is the body of long axis of the body. Okay, here this was the cervix and this was the vaginal axis. Here long axis of the body of the uterus, okay, will be bent forward at the level of isthmus here. Isthmus is nothing but the internal os of the here near the cervix. Okay, it's internal os. It will be bent over at the level of isthmus on the long axis of cervix, forming an angle of about 170 degrees. Some books also say this has 120 degree. Okay, that is also fine. So, once this angle is angle of anteflexion. So, that is why we say the uterus in as an anteverted and anteflexed position. So, the uterus is located in the lesser pelvis, that is in the true pelvis between the bladder. So, you can see the bladder in front. Okay, so this is the bladder and the rectum behind. So, the peritoneum here, when it reflects over, okay, the uterus, so here we can see the peritoneum reflecting over the anterior surface of the rectum, and then here it extends up to the middle part of the rectum and then reflects over, okay, the posterior upper part of the posterior fornix of the vagina here, and then over the posterior surface of the body of uterus. Yeah. So, here this one peritoneum, it will reflect over the posterior fornix of the upper part of the posterior fornix of the vagina, the posterior surface of the uterus, then over the fundus here, okay, and then over the anterior surface of the uterus, and then reflects onto the superior surface of the bladder, and then it becomes continuous with the anterior wall of the peritoneum here. So, here it will form two pouches here. So, this pouch we call it as the recto-uterine pouch, pouch of Douglas, and this pouch we call it as the uterovesical pouch. This pouch and this pouch here we call it as the uterovesical pouch. Right. So, here now when we see the relations, the body of the uterus, okay, so the body of the uterus is related to this uterovesical pouch as well as to the superior surface of the urinary bladder. Then here when we see the supravaginal part, so anterior relations, when we see body is related to the superior surface of the bladder, then this portion, that is the supravaginal, above the vagina, supravaginal part of the cervix, will be related to the posterior surface of the bladder here. So, this portion, and then the vaginal portion of the cervix here will be related to the anterior. So, this is the anterior fornix of the vagina. So, it is related to the anterior fornix of vagina. Then posteriorly the body of the uterus here will be related to the recto-uterine pouch. Okay, this pouch along with there will be coils of jejunum and ileum. Okay, so in this, so it is related to here, and the supravaginal part of the cervix will be related to the again to this recto-uterine pouch here, okay, with the coils of ileum as well as the sigmoid colon will be present there. And the vaginal portion of the cervix here will be related to the posterior fornix. Vaginal portion of the cervix will be related to the posterior fornix of the vagina. And laterally, the body of the uterus will be related to the broad ligament and uterine artery and vein. Okay, so laterally it will be related to the broad ligament, uterine artery and the vein, and the vagina will be the supravaginal portion of the cervix will be related to the uterine artery as well as to the ureter. Okay, so where the ureter will be crossing the uterine artery, and the vaginal portion of the cervix will be related to the lateral fornices of the vagina. So that will be the relations laterally. Okay, so laterally the body will be related laterally to the broad ligament, the supravaginal portion of the cervix, supravaginal part of cervix will be related to the uterine artery and ureter, and vaginal portion of the cervix will be related to the lateral fornices of vagina. So that is the relations of the uterus. So let's look at the parts of the uterus. So briefly I told you about the different parts of the uterus. So we had the fundus, the upper part is the fundus. So the uterus mainly is divided into two parts. Okay, so the larger part we call it as the body, and the smaller lower cylindrical part we call it as the cervix. So 2/3, upper part 2/3 is formed by the body, whereas lower 1/3 is formed by the cervix. And the junction between this body and the cervix, here we call it as the isthmus or the internal os. So uterine tubes will be attached to the upper part of the body. At the lateral angle it will be attached. Then the body here, if we see, it will be expanded like a dome. Okay, so the upper expanded part of this body, okay, like a dome where it is expanded, we call it as the fundus. So this body extends from the fundus to the isthmus, and this cavity, it will be having a cavity which we call it as the uterine cavity. So the uterine cavity is flattened antero-posteriorly. Okay, antero-posteriorly it will be flattened, and the uterus will have anterior surface and a posterior surface, right here. And this is the cervix part. So cervix is this lower cylindrical part. So it extends from the internal os up to the external os. Internal os will be near the isthmus part here, this portion. This is the external os. So here clinically when we see, okay, so the cervix here we divide it into two parts. One is the upper supravaginal part and the lower part, which we call it as the vaginal part. Okay, vaginal part of the cervix and the supravaginal part of the cervix. So clinically this isthmus or the internal os is formed by the upper. Okay, the internal os is formed by the upper one third of the supravaginal cervix. Okay, so this we call it as the lower uterine segment. Okay, so this portion we call it as the lower, in clinically obstetricians call it as the lower uterine segment. So why it is called like that is basically because the structure is similar to the body of the uterus, right? So usually when we talk about the implantation, implantation we say it occurs in the upper uterine segment in the posterior wall. Okay, that means it is occurring in the body near the upper part of the posterior wall. Okay, lower uterine segment usually results in what we call it as placenta previa. Right. So this is about the parts here. So when we see the cavity, okay, so the cavity of the body, this is the cavity proper here. It is mainly triangular. So it is triangular. We will use a different color here. So this is triangular here, which we can see in coronal section. So the apex of the cavity will be directed downwards, okay, continuous below with the cervical canal. So this is the cervical canal here, and it becomes continuous through that cervical canal to the internal os. So commonly the implantation will be occurring, as I said, in the upper part, okay, or that is upper uterine segment in the posterior wall. So when we take a sagittal section, this cavity, it appears like a slit, just like a small thin slit, because both the walls are in contact. Then the cavity of the cervix here, we call it as the cervical canal. Okay, so it is like a spindle shaped. Okay, so cervical canal is like a spindle shaped. So it is broader, so like a spindle shape, so broader in the middle, whereas narrower in the upper as well as in the lower part it is narrower. So it will be communicating, okay, so this cervical canal will be communicating with the cavity of the uterus through the internal os and with the vagina through the external os. So in the nulliparous women who have not given birth, okay, the shape of the external os will be small. Okay, it is small and circular. So this we see it in nulliparous women. And in multiparous women, those who have given birth like to 2 or more babies, right, the external os will appear like it's large and it is transverse. Okay, and it will have 2 lips, the anterior and the posterior. This we see it in multiparous. So coming to the ligaments of the uterus, so we have 2 types of ligaments of uterus. So they include the true ligaments and the false ligaments. Okay. So the true ligaments are basically fibromuscular bands. And the false ligaments are peritoneal folds. Okay. So basically we have 2 types of ligaments, the true ligament and the false ligament. So true ligaments are fibromuscular bands and false ligaments are peritoneal folds. So here the peritoneal folds, they do not provide support to the uterus, whereas the fibromuscular bands, they provide support to the uterus. So that is why we call them as the true ligaments. So now here one of the false ligament is the peritoneal fold we have is the broad ligament. Okay, so this is the broad ligament here. So contents within this broad ligament is important. So these false ligaments, we have 2 paired and 2 unpaired. Okay, so the broad ligament is a paired. We have the right and the left. So this broad ligament, so it has 2 surfaces. Okay, 2 surfaces and 2 borders here. So the broad ligament will be subdivided into 4 parts. So mesosalpinx, when we say, it is the part of the broad ligament. Okay, mesosalpinx part is the portion of the broad ligament that is between the fallopian tube. Yeah, so here I can show you. It has 4 parts. So first part is this portion here. Okay, this portion here. It is between the uterine tube. This is the first part, which we call it as the mesosalpinx. Okay, mesosalpinx. So it is the portion of the broad ligament between the uterine tube, okay, the fallopian tube and the ligament of ovary. So this portion is mesosalpinx. Then we have the mesometrium. So mesometrium is the part of the broad ligament which extends from the pelvic floor up to the ovary. Okay, so this is the mesometrium. Okay, so this portion we call it as the mesometrium, extending from the pelvic floor up to the ovary. Okay, so it extends up to the ovary, to the, that is the ligament of ovary, as well as to the body of the uterus. All these parts it will include. Okay, the ovary, the ligament of ovary and the body of the uterus. So that portion we call it as the mesometrium. So meso is basically the term we use, like not for all, like we have the mesocolon. So basically it's the fold of the peritoneum. So here we are calling it as mesosalpinx, where it is in relation to the fallopian tube, mesovarium where it is in relation to the ovary, and mesometrium here where it is in relation mostly to the body of the uterus, along with the ligament and the ligament of ovary and the ovary itself. Then we have meso-ovarian part. So in this portion we have the meso-ovarian. So meso-ovarian is the fold of peritoneum extending to the ovary here. Okay, and here this portion we will have the this portion here, meso-ovarium. Okay, so meso-ovarium. And we have the last portion, the 4th portion, that is this part, which we call it as the infundibular. Infundibulopelvic part of pelvic ligament. Okay, infundibulopelvic ligament, which is also known as the suspensory ligament of the ovary. So this will be extending from the infundibulum of the tube to the upper pole of the ovary here. Okay, infundibulum to the upper pole of the ovary, this ligament will be extending, which we call it as the infundibulopelvic ligament. So this infundibulopelvic ligament will be containing the ovarian blood vessels, nerves, lymph vessels are present in that. So this is what we will see it in this region. So next, coming to the contents of the broad ligament. Okay, so what are the contents? That is one of the most commonly asked MCQ question. So the broad ligament, the contents of it is very important here. So as I said, it has one tube. Okay, it has one tube, that is the uterine tube within it, and there are two ligaments. So which are the two ligaments here? The round ligament of the uterus. Okay, the round ligament of the uterus as well as the ligament of the ovary. So here we see the ligament of ovary and the round ligament of uterus. This is the ligament of ovary. Okay, and the cross section will be able to see the round ligament of uterus. Then we have two arteries. So which are the arteries we see here? This is the uterine artery here. Okay, uterine artery as well as the ovarian artery. Okay, ovarian artery. Then we see two plexus of nerves. So two plexus of nerves, which includes the uterovaginal plexus. Okay, so uterovaginal plexus of nerves around here, and other one will be the ovarian plexus around the ovary. So two plexus of nerves, and then we see three embryological remnants. Okay, three embryological remnants. So here embryological remnants which we see here will be the Gartner's duct. Okay, so here we can see the epiphoron. So this is the epiphoron and Gartner's duct. Then we see the parophoron and the vesicular appendages. Okay, so these are the three embryological remnants which we see within the broad ligament. Then other than this, we see the other structures, that is the lymph vessels and the lymph nodes, the fibrillar tissue. All of that are seen within the broad ligament. Okay, so you have to remember the 1, 2 and 3, that is one tube, two ligaments and two arteries, as well as two ligaments, two arteries, two nerve plexus. Okay, so that is two lap, two ligaments, two arteries and two nerve plexus, and three embryological remnants. Okay, 3 ER, embryological remnants. So that is how you can try to remember. So one tube, 1T, 2 lap, 3 ER. So that is one tube, two arteries, two ligaments, two nerve plexus, as well as the three embryological remnants. So when we see in the cross sections, we can see some of the structures here. This is the sagittal section here. In the sagittal section, we are able to see. So this is the mesosalpinx part of the broad ligament. Here we have the uterine tube. So this is the uterine tube. This is the ligament of ovary. This is the round ligament of uterus. So round ligament of uterus will be anterior-inferiorly to the uterine tube, and posterior-inferiorly will have the ligament of ovary. And here we can see the broad ligament of, this is the broad ligament of uterus. Uterine artery. This is the ureter crossing the uterine artery. So you can see the ureter and above which the uterine artery is crossing here. Okay, so this uterine artery crosses. So the uterine artery, it is a branch of the anterior division of the internal iliac artery. So once it begins, it crosses. Okay, so from the lateral to it comes towards to medially, and then it will ascend upwards. Okay, so along the lateral border of the uterus, it will ascend upwards. So as it is ascending upwards, when it ascends, it will cross over the ureter. So this is crossing of ureter by the uterine artery. And here we can see the cervix. So this is the structures which we see in the sagittal section. So coming to the blood supply. Okay, so blood supply of the uterus, it is supplied by two uterine arteries, the right and left uterine arteries and the right and left ovarian arteries. Okay, so here we can see the uterine artery, and here we have the ovarian arteries. So two uterine arteries and two ovarian arteries supply the uterus. So the uterine artery now is a branch of, so uterine artery is a branch from the anterior division of internal iliac artery. So it will run medially. Once it begins, it runs medially to across the pelvic floor to the base of the broad ligament. Okay, so that is what we saw here previously in this picture. It runs towards the base. So this is the broad ligament here, towards the base of the broad ligament. It will run medially. So here, once it runs medially here, it crosses the ureter, and it will, okay, crosses the ureter from above and lateral to the cervix, and then, so at the level, so here, okay, at this point, lateral to the cervix. So cervix is here, lateral to the cervix, and superolateral to the fornix of vagina. So this is the vagina. So superiorly and laterally to the fornix of vagina and laterally to the cervix. At this point, it will cross the ureter and then it will ascend upwards. Okay, so it ascends along the sides of the uterus, and at the superolateral angle of the uterus, it will again turn laterally, where it will anastomose with the ovarian artery. So now here when we see how it supplies the uterus, okay, so the blood supply to the uterus, when we see close to the cervix, okay, so it gives this after crossing, right, after crossing the ureter, it will give cervical branches, vaginal branches, as well as the ureteric branches, that is supplying the ureter also. So cervical branches now, the cervical branches will form a circular anastomosis around the isthmus. Okay, they will be forming us around the isthmus. Isthmus is nothing but the internal os. So the cervical branches will form a circular anastomosis there. Then along the side of the body of the uterus, it will give what we call it as the arcuate arteries. Now here we are seeing along the side of the body. So this is basically a transverse section of the uterus. So this is the uterine artery now. This is the uterine artery. Now here it will give what we call it as arcuate or coronary arteries. This is the arcuate or coronary arteries. Okay. So coronary branches which will run transversely on the anterior as well as the posterior walls, surface of the body of the uterus. And they will anastomose with the opposite branches. Okay, in the midline they will be anastomosing here. And along the fallopian tube above, no, they will also give the tubal branches, that is to the fallopian tube. So that is how the uterine artery will be supplying all these structures. Now in the uterus, inside the uterus, right, it has what we call it as the intrinsic uterine circulation. So this is an interesting thing, how it supplies the different layers of the uterus. So here in the outside wall here, we are seeing it giving the arcuate arteries, right. Now these coronary branches or the arcuate arteries of the two will have two, one anterior and one posterior, and they will be anastomosing with each other, okay, of the opposite side. And now from here the straight arteries here we will see, which we call it as the radial arteries. Okay, so this from the arcuate artery we will have the radial arteries. So radially they will be branching out from this arcuate arteries. Now these radial arteries, they pierce the myometrium. Okay, so the radial arteries will pierce. So they are piercing the myometrium here. The myometrium, like centripetally, they will pierce and they will anastomose. Now here if you see, they are all anastomosing with each other to form what we call as the circulus, or we call it as the stratum vascular. Okay, so they will anastomose. Okay, they form a circular anastomosis which we call it as the stratum vasculaire. Okay, so this stratum vasculaire is formed by the radial arteries which will pierce through the myometrium of the uterus and they will anastomose with each other, forming the stratum vasculaire. Now from the stratum vasculaire, now if you see, we will have two sets of branches beginning. Okay, one we call it as, now if you see here, there are the three layers of the uterus. We have the outer perimetrium, the myometrium and the inner endometrium, right? So the endometrium will have two parts, the stratum functional and the stratum basal layer. So accordingly, this from the stratum vasculaire, we will have two branches, one going to the stratum basal, which we call it as the basal arteries, and one going to the functional layer, which we call it as stratum functional, or the spiral arteries. Okay, so they are called as the spiral arteries which go into the stratum functional. So this basically, okay, so these spiral arteries, right, the functional zone which is cast off by the during menstruation is basically supplied by the spiral artery, and whereas the basal layer which helps in the regeneration is supplied by the basal artery. So that is the circulation. And the venous drainage corresponds to the arteries. They form a venous plexus along the lateral borders and they drain into the internal iliac vein through uterine and vaginal veins. Next important is the lymphatic drainage of the uterus. Now why lymphatic drainage is important? Because the spread of cancer, okay, the malignant spread of uterus is through the lymphatics. So now we will see here how the lymphatics will form. So from the fundus, okay, so here if you see from the fundus and the upper part of the body of the uterus, the lymphatics are mainly draining into the pre and para aortic group of lymph nodes. So it drains into the pre and, okay, the pre and para aortic group of lymph nodes. Okay, so here pre and para aortic group of lymph nodes. So along the ovarian vessels, it will be draining into this. And few from the lateral angle of the uterus. So here if you see a small portion from the lateral angle of the uterus will be draining into the superficial inguinal group of lymph nodes. Okay, so here it drains. And from the lower part of the body. So this was from the fundus and the upper part of the body. Now from the lower part of the body, the lymph vessels drain into external iliac group of lymph nodes. So from here it drains into the external, okay, it drains into the external iliac lymph nodes. External iliac lymph nodes. So that is, they pass through the broad ligament and they will drain into the external iliac group of lymph nodes. So that is from the upper part of the body as well as the lower part of the body. Okay, so upper part of the body mainly to para-aortic and from the lateral angles to the superior inguinal group of lymph nodes and from the lower part to the external iliac group of lymph nodes. That's it. Now we have from the cervix. So from each side, okay, the laterally if you see, the lymph vessels, they drain into the external iliac as well as they go to the external iliac and also to the obturator group of lymph nodes. Obturator lymph nodes, okay, and posteriorly, that is from behind, okay, so from the posterior and laterally, they drain into the internal iliac group of lymph nodes. So they drain into internal iliac lymph nodes, okay, they drain into the internal iliac lymph nodes. by passing along the uterine vessels. Then posteriorly, okay, so posterior laterally it was going there, and posteriorly it will be draining into the sacral lymph nodes, right. So that is from the cervix. So cervix from the lateral side goes to the external iliac as well as to the obturator lymph nodes. Posteriorly and laterally goes to the internal iliac and posteriorly to the sacral. So based on how it is related to the regions around, okay. So in that way it goes to those corresponding lymph nodes. Next we move on to the supports of the uterus, okay. So supports of the uterus is basically formed by the 4 structures, okay. So that is we have the primary support, as well as we have the secondary supports. Okay, so the primary supports and the secondary supports of the uterus. So when we go to the primary supports, so what are the primary supports? Primary supports are mainly contributed by the muscles, that is the muscular support it has. It has visceral support from the neighboring viscera, and it has the true ligament support, that is the fibromuscular support. Okay, so these are nothing but the true ligaments. So when we see, okay, the primary, that is the muscular support. So what forms the muscular support there? So it is one muscle, that is a body between two. So to remember the muscular support, right? It is B between 2D, that is the body between two diaphragms there. Okay, we have the pelvic diaphragm, the perineal body, as well as the urogenital diaphragm down there. So those 3 structures, okay, form the muscular support. The pelvic diaphragm, the perineal body, and the urogenital diaphragm. Coming to the visceral support, what do we have in front? We have the urinary bladder, and then the vagina, okay, and the uterine axis, the position of the uterus as such, the vagina, the fornices, okay, as well as the bladder in front. So they will provide the support. That is the visceral support. So basically when we are saying the supports are preventing the prolapse of the uterus. Understand? That is why, so we call them as the primary supports. And fibromuscular support. So fibromuscular support is mainly formed by the true ligaments. So true ligaments, when we see here, okay, they are all paired. We have a pair of transverse ligament. This is the transverse cervical ligament. Then we have a pair of uterosacral ligament. Uterosacral ligament. Then we have pubocervical ligaments. Okay, pubocervical ligament, and we can also see the round ligament. So the transverse cervical, the pubocervical, then we can see here the uterosacral, the pubocervical here, okay, this is also in this section we can see like this. So pubocervical here. So these are all, so the transverse ligaments, transverse cervical, the pubocervical, the uterosacral and the round ligament, they form the fibromuscular support, okay, and they are nothing but the true ligaments. So when we come to the secondary, okay, so secondary we have the false ligaments, okay, the false ligaments which form the secondary support here. So here basically we have two paired and among the false ligaments there are 2 paired and 2 unpaired, okay. So the 2 paired will be the broad ligament. So broad ligament forms the support. Then we have the recto-uterine folds, okay, the recto-uterine folds they form, and then we have one uterovesical fold, okay, so that will be here between the uterus and this thing. So here uterovesical and rectovaginal fold. So here we will see the uterovesical fold, and here we will see the rectovaginal fold. Okay, so these folds, they are unpaired and they form the part of false ligaments also, and they are the secondary supports to the uterus, preventing its prolapse. So coming to the image based MCQs, the normal position shown is best described as, so normal position of the uterus is anteversion with anteflexion, that is the normal position. The labeled ligament providing primary support, so it is going transversely from the cervix here to, that is the transverse cervical or cardinal ligament. Okay, so this transverse cervical or cardinal ligament is also called as the McEnroe's ligament. Okay, so since it is the main support, it forms the primary support, right? We call it as the cardinal ligament. Then we have the artery shown here is a branch. The artery shown is the uterine artery, and uterine artery is a branch from the anterior division of internal iliac artery. So B is the right choice. Lymph from the region shown primary drains into, okay. So it is from this is the upper part of the body. Upper part of the body drains primarily into the pre and para-aortic group of lymph nodes. Yes. So C is the right answer. The pouch shown is, so pouch shown is the between the rectum and the uterus, so recto-uterine pouch. B is the right answer. So that's a wrap on today's session of anatomy of uterus. So stay consistent with the series as they bring you one step closer to your NEET PG dreams. So stay focused, stay consistent and trust in your preparation. I'll see you in the next session.